An annual well child visit is an important thing, and we do a collection of processes and parts of that visit. First is we get a good history of what you've been noticing with your child since the last visit. That would include just their normal development process, what things they're starting to work on learning and developing now. Look at how their growth is going, how they're eating, and all happening. We like to then do measurements, including our physical exam, so we get heights and weights and blood pressures, usually starting at 3 years old, because children can have high blood pressure too. So we look at their development and do developmental assessments, and we then try to make sure that they're up to date on their immunization. We do ask your input of whether they've had any other health visits between our last well visit, so that if they're having visits to the ER or the hospital or other things like that, we make sure that we're connected to that and know that information so that we have a complete picture of your child. One of the things that we especially like to emphasize is that we still want to have our regular visits even during the time with COVID, because your child is still progressing, and their care and their health is important even during this time, and we can still make sure that they're up to date on their vaccines, which we need to protect them from the other illnesses that they could still get, and so we want to have them in their safety. So their growth and development now is as important as ever, and we've set it up so that we can do it safely without risk of acquiring the disease, and we look forward to seeing you.